Welcome to all on behalf of the University of Miami Institute for Advanced Study of the Americas. Thank you for returning to share with us for our second in this series on COVID-19 in the Americas. Today, we're going to be talking about politics and policies. And for those of you who are first-time listeners, thank you for joining us. I hope you'll continue to do so in this series that is now going to be co-moderated, as you're going to hear in a minute, by myself and my colleague, Salómon Chertorivzki. Remember, please, and go ahead at any time that you can send your questions into the chat box, and that the final 25 minutes of our hour together will be devoted to answering as many of your questions as we can. We had more than 1,600 hits this time looking at our page, and we're going to see how many are with us this time. Last time we had more than 950 people signed up and over 600 people who listened for our full hour with Dr. Julio Frank in our last session. Richard Horton has just written in The Lancet recently, coronavirus is the greatest global science policy failure in a generation. That's what we're going to be speaking about today. It's 2 weeks from the last time I reported on some of the numbers. We are now looking at close to 200,000 deaths from this disease. Yesterday, the world registered just over 6,600 lives lost. In the United States, we're close to 50,000 deaths, and we're over 2,300 souls a day that are leaving us to COVID. In Florida, we have seen this scourge come in quickly. We're seeing the numbers go up very rapidly. As of today, we are close to 30,000 cases that we know of, and very close to 1,000 deaths in our own home. And in Mexico, also reporting close to 1,000 deaths as of today. In our last webinar, Julio Frank, president of the University of Miami, mentioned that if there is any upside to this pandemic, it could be that countries could learn from each other, that we could identify opportunities for global solidarity, that we could find better ways of moving forward in a stronger, healthier world. It's unclear to what extent that is happening. Very unclear that countries are learning from each other. Very unclear as this virus, as this disease moves south, how low and middle income countries are going to be able to manage it. What is clear is that public policy matters. It matters for the economy, it matters for the health of people, it matters for our societies. We're very, very fortunate today to have with us two policy experts. They've both held government positions, leading government positions in Mexico, and are recognized intellectuals and voices from the region. I'll introduce both, and then I'll tell you a little bit about our panel. First, just to tell you, my name is Felicia Knaul. I'm the director of our University of Miami Institute for Advanced Study of the Americas, and also proud to lead a small NGO in Mexico, Tomatela Pecho, the country that I call home. Now let me tell you about our panelist. Dr. Jorge Castaneda was Foreign Minister of Mexico from 2000 to 2003. He's a renowned public intellectual, political scientist, a prolific writer with a deep interest, a keen interest in Mexican and Latin American politics and comparative politics. He's held professional positions at Mexico's National Autonomous University, Princeton, and the University of California, Berkeley. And now his professorial appointment since 1997 is as Global Distinguished Professor of Political Science and Latin American Studies at New York University. Jorge Castaneda was a senior associate at the Carnegie Endowment for International Peace and is a John D. and Catherine T. MacArthur Foundation Research and Writing Grant recipient. A renowned intellectual leader, Castaneda has more than 15 books published in the United States and in the region. He's a regular columnist for the Mexican daily El Financiero, for El País of Spain, and also for the New York Times. He's been a member of the board of Human Rights Watch from 2003 to 2019, and he was elected in 2008 for an honorary member of the American Academy of Arts and Sciences. We're also extremely proud at the University of Miami that Dr. Castaneda has an honorary doctorate that was bestowed on him in 2016. And I am very, very pleased and very grateful that he is a very active member of the External Advisory Committee, the scholarly committee that leads our University of Miami Institute for Advanced Study of the Americas. Salómon Chertorivzki Woldenberg is a Mexican politician and an economist. He served as Minister of Health of Mexico during Felipe Calderón's administration. He was also Secretary for Economic Development in Mexico City from 2012 to 2017. With a master's degree both from the Autonomous Technological Institute of Mexico and in public policy from Harvard University. During Salómon's tenure as National Commissioner for Social Protection and Health in 2009, the country achieved universal health coverage with the affiliation of over 53 million Mexicans, and agreements were signed to offer the Seguro Popular at that time to Mexican immigrants in the United States. Salómon is currently Professor of Public Policy at the Center for Research and Teaching in Economics, CIDE, and Chairperson of the National Advisory Council, Pensando en Mexico. We are also very proud to share that Salómon is a collaborator of the University of Miami and also a fellow at the University of Miami Institute for Advanced Study of the Americas. Let me briefly tell you what our run of show will be. Salómon and Jorge are going to have an interactive dialogue for roughly 25 minutes. I'll then turn to questions from our audience for another 25 to 30 minutes. We will do our best to answer as many as we can, and certainly to share the list of questions with everybody who's on board. We'll go over 4 topics with a strong focus on Mexico and Latin America. What are recent trends and impacts that we're seeing as a result of the spread of coronavirus? What is the political climate that we're living in Latin America? What are the greatest risks moving forward for places like Mexico? And how can we look forward? Are there positive issues on our horizon? Again, it's been 2 weeks since our last webinar with Dr. Julio Frank, our president. We're going to discuss now with our moderator and our panelists how the COVID-19 pandemic has evolved in Latin America from an economic, a political, and a public policy standpoint, focusing on Mexico. How might it evolve differently in Latin America compared to what we have witnessed in Canada, the US, or Europe? How will poverty, inequity, and risks like corruption play into what we'll see? And more than anything, how can governments do a better job? I'll turn it over now to you, Salómon.
Now, thank you very much, dear Dr. Knaul. It is always a pleasure to have the opportunity to be at the University of Miami. As President Frank always say, we are living a physical distancing, not a social distancing. We can be together with these new technologies and a possibility of seeing each other. It's fantastic. It's just fantastic. We're living at least 2 crises. And I say at least, but probably are the most obvious crises. We're living a health crisis and we're living an economic crisis. Both of them need policy and both of them need politics. In Latin America, there's a huge heterogeneity in terms of health systems. I would say that the Mexican health system was a very robust system. I mean, it wasn't perfect. It was far from being perfect, but it was a robust system. It has been weakened over the last couple of years. The most difficult part that the Mexican health system lived last year was the destruction of the so-called Seguro Popular, or popular insurance. That was the insurance for more than half of the population that did not have an employer, and because of that did not have Social Security, through which half of the other half of the population received medical attention. Well, for those 53 million people that used to have Social Security, since we start this year, they are like in a limbo. So the Mexican system has been weakening over the last couple of years. It is with those weaknesses that we receive the coronavirus. We have to say that also the Mexican system on terms of epidemiology and public health was strengthened because in 2009, Mexico, with the H1N1 crisis, Mexico was the Wuhan of the world. We were the epicenter of the crisis. So we were supposed to learn from that crisis and be better prepared in order to achieve better results. But what we are living in Mexico and what we are living in Latin America, and what in terms of health policy should be some of the questions we should answer to see how countries have been working. One of them is how the health authority is giving directions, is given instructions. If these instructions are clear, are transparent, if people, agencies, subnational governments know what to do after the recommendations of the health authority. That authority is crucial, is central. The directions and the mandates of the health authority are fundamental in terms of policy to attend an emergency. Second, how well a government communicates. What are the stages? What are we living? What should we expect as citizens? That communication and how leaders react and act is fundamental in order to see how countries are going to survive or work through this crisis. How well did we prepare in terms of physical, material, and personal health resources in order to resolve the crisis? Because we had 3 months in advance to learn what was happening in Asia, what was happening in Western Europe. We have that advantage. How well did we use those 3 months in order to be prepared? How well did we test and map? And we learned from what other countries did well and what other countries did not do well in order to respond to the health crisis. And moreover, if we were going to stay home, how well does the governments put inside an economic plan in order for all those people that live with what they, or with their income, the daily income? How did government answer to that economic part in order to understand and to react on the at the end, the mandate of staying home? In this umbrella, we can evaluate how policies at the end work and how physical distancing really help in order to reduce the number of people that at the same moment in time are going to need critical attention on our health systems. Those are the parameters in which we should evaluate the policy of the hemispheric attention to the health crisis. But let me stop with the health introduction, because we want to get more into politics and into policy. So I'm gonna turn the table to my very, very dear friend, Jorge Castaneda, who I admire and I follow him and I listen to him, I learn from him. But let's start, Jorge, talking about policy and politics. Given the current trends of the pandemic, what impact do you think the pandemic is having in politics around Latin America and in policy around Latin America? What is your first take on it?
Well, I think the first point, Salomon, besides thanking Felicia for having us here and having the opportunity to share these thoughts with you in particular, as we do all the time in Mexico City as friends, but to do it with those who are listening and watching us. The first issue is that the pandemic is having already an enormous economic, social, and even political effect almost everywhere in Latin America. To begin with, of course, the economic downturn will be devastating. Several international agencies, regional agencies have already forecast how much these economies will contract, anywhere from -4, -5 to up to 2 digits, depending on the country, depending on who's doing the estimate. This will be, without a doubt, the most important economic contraction in Latin America since the 1930s. Much more, in the case of Mexico, for example, much more than 2009, much more than 1995, much more than 1982 and 3. So this is a first fundamental consequence of the virus, of the crisis, of the pandemic. We don't know how long it will be until the recovery comes. The second point is that the social consequences of this economic contraction will be also devastating, because these are countries, with a few exceptions marginally, these are countries with huge informal sectors of their economy, with an enormous amount of people who do not have the type of universal health coverage that Mexico did have, thanks to the work that you and Julio Frank did, creating the Seguro Popular, because they do not have a welfare state like Western Europe does, even the United States. To think of it, most countries in Latin America, and certainly Mexico, do not have unemployment insurance. If you lose your job, you get nothing under normal circumstances, absolutely nothing. And most of the time you lose your health care coverage also, but mainly you have no unemployment insurance. Well, this means that the millions of people who are being laid off across the region, the estimates for Mexico are as high as 2 million people to be laid off by the time this is over, will not have any type of compensation or safety net for the time they will be without a job. The social consequences of this can be enormous, because we're talking about people who are mostly still living in poverty, not extreme poverty, but poverty nonetheless. 40 to 45% of the people of most countries of Latin America continue to live in poverty. Chile is an exception, but most other countries, that is the situation. So people in poverty, without unemployment insurance, without health coverage, lose their job, lose their income. This is a devastating social consequence of the pandemic. And finally, the political consequences. I guess it's just good luck that there are no major elections this year in Latin America, the exception being the Dominican Republic next month in May, that holds a presidential election. They still haven't canceled it as far as I know. They might, but other than that, that is the only really important election this year in Latin America, which means that the consequences of everything I've just mentioned will not show up at the ballot box this year. But that does not mean that there will not be protests in the streets against the policies that are being implemented. We can come back to that. Secondly, that there will not be an increase in violence, crime, and delinquency. We are seeing this in Mexico for the last couple of weeks. Hard to say if it's a trend or it just happened to occur that way. And in general, there is also the possibility that in countries with a long tradition of corruption, like Brazil, like Mexico, Peru, Argentina, that we will see a spike in corruption, because all of a sudden you are beginning to see either black markets or gray markets for a series of goods and services that are scarce or that are not allowed, And then, of course, all of a sudden, you have a new black market or gray market emerging where you can get the stuff, goods, and services that you can't access otherwise. That feeds corruption like crazy.
That of course, and you put into place not only the economic and the health crisis, but a social crisis that could have to do with corruption, with security issues. We know that with economic crisis, then security issues may be hardened. So we are living difficult times. How do you see Mexico compared to other countries in the region acting through this crisis? I mean, it's multiple crises. How our leadership in Mexico is solving or resolving the possibilities of each of these crises, Julio?
Well, I'm not sure they're solving or resolving anything at all, Salomon, but there are a few comparative elements that we have. First of all, we know that most countries in Latin America, ECLAC, the United Nations Economic Commission for Latin America and the Caribbean, has published statistics on this. They have an observatory for these issues. What percentage of GDP each country is devoting to a special fiscal effort beyond monetary policy, a fiscal effort to try and contain the economic contraction and possibly turn it around. We know that Mexico is spending less than practically every country in Latin America. Some countries are spending a lot. Chile is upwards of 5% of GDP. Brazil, with its new program of universal basic income, which was just approved by Congress today for 60 million Brazilians, is also going to be spending around 5 to 6% of GDP. Mexico so far is below 1% of GDP in the fiscal stimulus. The United States is well over 10%, may reach 20. Countries in Western Europe are upwards of 30%, depending on the country. So this is one fundamental issue there. Mexico is not doing what the others are doing. Now, how are others spending this money? Some, like the United States, are spending it, like Brazil, by giving money directly to people. This is what the Trump administration fiscal stimulus is about, approved by the Congress, by the Senate, a new package just today. Basically, it gives money, as much money as possibly, directly to people by increasing the length or the amount of unemployment insurance, by sending out checks through the IRS directly to people, by loans to small businesses, etc. Other countries, like in Western Europe, have decided to protect jobs. They give money, they pay salaries to people who are not going to work, but are not being laid off either. Mexico is doing neither one nor the other. And so we are rapidly going to find ourselves in a situation with an enormous amount of people that have lost their jobs, lost their income, and have no direct help from the government.
And because of the lack of that immediate help, there are some calculations, for example, from the think tank Espinosa Iglesias, that calculates that with the economic crisis, we're gonna see in Mexico an increase of at least 20 million more people getting into poverty. So consequences may be huge. But let me try to understand your vision on how the region is going to move, to work, the relationships, and mainly with President Trump's administration. How this pandemic is shifting, moving or not, the relationship, the political relationship between the region and particularly with Mexico, Jorge.
Well, Salomon, it's affecting Mexico, of course, more than any other country in Latin America because we share the border with the United States. But also countries in Central America and the Caribbean are being affected directly or indirectly. One of the most direct consequences has to do with migration. Just yesterday, President Trump signed an executive decree suspending the delivery of green cards or permanent residences to anybody who is in the pipeline. Hard to say how many people this affects. There's one estimate today saying over 100,000. We don't know how many Mexicans are in that pile, but normally half of the people who get green cards, half of the people who get any kind of work visas in the United States tend to be Mexicans. So that gives you one kind of an idea. Secondly, the expedited deportation of people who enter the United States unlawfully, instead of having a hearing, being placed in detention centers, they are being deported immediately, without a hearing, without anything, being sent either to Mexico, even if they're not Mexican, or to their own countries. And a lot of them are being sent to Mexico, according to many NGOs, are being sent to Mexico, whether Mexican or not, infected but with coronavirus, with COVID-19, which is going to place a greater strain on the health, on the weakened health systems that you mentioned in Mexico, in Guatemala, in Honduras, in El Salvador, and probably also in the Caribbean. And finally, Mexico has some specific issues which are just coming now, emerging. There's a letter today from 320 companies in the United States belonging to the North American Manufacturing Committee or Council, addressed to President López Obrador in Mexico, asking him to open up to catalog as essential factories those companies, those factories operating in Mexico that belong to supply chains that continue in the United States and in Canada. The obvious case are auto parts for the automobile industry. If a plant in Michigan building cars, or in North Carolina, or in Alabama, or in Tennessee, where there are so many, needs parts from Mexico to build a car, but Mexico considers that auto part company to be non-essential, it has been shut down by law. But that means the plant in Tennessee also has to shut down. So what they're asking for, reasonably enough, is let's do it in a mirror fashion. Let's have the definition of essential and non-essential be the same in all three countries because of the supply chains. When you put all of this together, you have a big new agenda for these countries, mainly Mexico, but the other ones also, with Trump and with the United States.
Yes, of course. And in this new, in this world, no, I mean, after the 2008-2009 financial crisis, we saw the rise of populism all around the world. We could talk about this, a lot of examples. But are you concerned that these populists that already have some taste for authoritarianism, are you concerned that the pandemic is going to raise the authoritarian part of some leaderships, as we have seen, for example, in Hungary with Orbán? Do you see this happening in Latin America? I mean, today it was clear that in Brazil, who gave who explains the economic measures was not the finance minister, it was the chief of the army. What do you think? What are your concerns in terms of how authoritarianism can or cannot grow in this time?
Well, we have two examples for the moment, Salomon: Brazil that you mentioned, and El Salvador, President Bukele, and President Bolsonaro in Brazil. Both of them have clearly resorted both to authoritarian rhetoric, which is not great, but at the end of the day, it's not the worst thing that can happen, but also to a certain amount of authoritarian practices or calls for authoritarian practices that can become very dangerous. In Brazil, you have a series of institutions that can push back against this. but still the role the army is playing, the way the previous health minister, your colleague, was fired, the type of policies that President Bolsonaro is encouraging, his attitudes are very great source of concern. The same is true in El Salvador, but President Bukele has gone much more, has actually done things. It's not just talk. He is arresting people for violating curfews. He is detaining people who are suspected of violating curfews, etc. It's a very authoritarian act. The temptation is present throughout Latin America because people obviously think that you need an iron hand, an iron fist, mano dura, in order to combat the coronavirus, increased crime, delinquency, etc. Now perhaps greater drug trafficking because governments have to concentrate their efforts on other things. All of these were going to call for mano dura. And that can become very worrisome because many of these Latin American countries do not have the strong institutions that would make this impossible to happen. Perhaps countries.
How do you see that risk in Mexico? Do you think there's a risk? Because until now, President López Obrador hadn't used the pandemic in order to get more power. But we've seen during these weeks a couple of movements from the government towards weakening other institutions. How do you see, how do you evaluate the risk here in Mexico?
Well, I would view it two ways, Salomon, and agreeing with you completely that so far nothing serious has happened in Mexico. The problem is, of course, that we have seen López Obrador's authoritarian temptation or drift before the pandemic. That was there already, with in many examples, autonomous institutions being threatened, the press or critics being stigmatized publicly by the president himself, etc. The pandemic itself does not seem to have led him so far to do anything that is worrisome so far. He continues to allow everybody to say what they want. He continues to not decree any kind of curfew or any kind of suspension of individual liberties or of the judicial system, etc. But, as you pointed out before, and you know this much far better than I do, of course, we have not reached the peak in Mexico yet. In fact, right now, the number of deaths in Mexico is very low. We're still at under 1,000 deaths. We're at under 1% of, not 1%, 1 per 100,000 deaths per capita. We're still at a very low level. So that doesn't, what is going to happen next week or 2 weeks from now? What is going to happen if the hospitals become saturated, if people are not able to find respirators or ventilators, people are not able to be hospitalized, people are not being able even to be buried for those who pass away. There is where it might get a little trickier in terms of authoritarian drift.
And that is most probably going to happen over the next couple of weeks. We are already seeing saturation in some hospitals, some cities, Mexico City, Cancun, Tijuana. So that scenario, Jorge, is going to happen over the next couple of weeks. Let me try to before getting back to Dr. Knaul, to my dear Felicia, and start answering some questions from the audience. Let me put a last one in this segment. How do you perceive the future? I mean, there's a lot of space for resilience, for rethinking how the world is going to get back to a different normality, but it's going to get back. How do you see that future? What are the risks on that future? And what are the positive things that you believe are going to happen on that near future when we return to normality?
Well, Salomon, I think that the kind of work you've been doing in Mexico with Pensando Mexico and others are doing in Chile, for example, preparing for their drafting a new constitution. It's been postponed, but they will do it. And many other countries in Latin America are going through this type of discussion. Two things have become apparent: that the enormous inequality in Latin America, which everybody knows about, which everybody talks about, and rightly so, when a crisis strikes like this one, a health crisis and an economic crisis, that inequality becomes much more visible, much more dramatic, much more painful, and is probably going to get worse. When we can look at Gini coefficients 3 or 4 years from now, after all of the household surveys have been carried out, and this will take time, we will almost certainly discover that these very unequal countries became more unequal. It's almost inevitable. The second issue is that we also discovered, we knew this, but it's different when you see it in all its stark contrast. And I'll give just one terrible example of this, but we will discover, we are seeing how the Latin American welfare states, or what exists in terms of a welfare state in most Latin American countries, Brazil, Uruguay probably has more, Chile has much less, Mexico is in the middle, what have you. These welfare states are terribly deficient. They do not deliver the goods. I was reading a story this morning in the paper. Hospital General de Mexico, in other words, one of the public's
the largest hospital in the country with more than 1,000 beds.
Well, a family was outside protesting this morning because they had gone to claim the body of their father, who had died of coronavirus yesterday, the day before, and they gave them the wrong body. They gave them a body, but not theirs, somebody else's body. And so they were protesting about this with big banners saying, "Give us our body, not somebody else's." How can something like this happen in one of the gems of the Mexican health system that you led during your tenure, and that we know is not perfect, but is not terrible either?
I completely agree. And in thinking about the future, because the other inequality, not only the economic inequality that we are going to see grow, is the technological inequality. I mean, we have seen children that keep on studying because they have internet, because they have a laptop or an iPad, and we have seen our public school children without the possibility of connecting. And that is going to create even a greater inequality gap between those who have access to technology and those who have not. Last question, do you see, for example, yourself as a professor of NYU teaching online on the future? Do you think this is going to shake the ways in which we interact, even at the university level?
Well, I hope it doesn't happen. I hope that by September, when classes start again, that things have been sufficiently worked out that we can avoid this. I don't like online teaching, particularly in a seminar. Both of my classes are small classes. In one, I have maybe 25 to 30 students, which we do with 2 professors, we co-teach. The other, I have 17 or 18 freshmen. With a small group like that, frankly, I think online is very uncomfortable and makes the exchanges that happen in a seminar much more difficult. No matter how good technology and advanced technology you can put in, it's not the same thing. The whole point of these types of classes in in universities like the University of Miami, like NYU, like many others. The whole point is to have small groups and a lot of exchange among students and between students and faculty. Online, it doesn't happen, Salomon. It's just not true.
There's no virus until now on the world history that has changed humankind to something different. So we need to get together. We need to hug. We need to be together.
Absolutely, completely. I agree.
Well, let me with that turn to my colleague Felicia to see if we already have a couple of questions. Felicia.
We do. What a wonderful conversation. Thank you to you both. And actually, in the process of conversing, you answered several of the questions that had come in, for example, around green cards. I want to pose the first one and lead into something that I'm extremely worried about. Yeah, and I think it's something we have not discussed around COVID-19 because we weren't as worried about this in Europe, in Canada, even in the United States. And that is the question of how corruption might actually impoverish our patients. I'm particularly worried because I know we've had recently a family that came to me very concerned because they wanted to know if they should purchase a ventilator that was offered to them on the street because we had run out of ventilators in one of our hospitals for a period of time. The patient actually ended up dying very unfortunately 2 days later. They did get a ventilator in the public hospital, but in the meantime, the family almost spent 85,000 pesos cash on a ventilator that needed to be hooked up. Ventilators don't work, the way that a radio might work. They have to be hooked up in a hospital. And someone had begun to tell them that this is possible. So, this risk, I know our hospitals are beginning to put signs outside, share information, but I don't think we have spoken as a world about how this can impoverish our patients.
Jorge.
Well, this example that Felicia gives us is not only tragic and terrible, but it fits very well into this question that we talked about a second ago of corruption, because these are everywhere. I mean, in New York City, ventilators and hospital beds and intensive care units are scarce goods and services. And they are scarce in a way that other things are not. These are life or death issues, and families are quite logically willing to do almost anything to obtain these scarce goods or services if their loved one's life is at stake. But it's one thing in New York. I don't think you can buy a ventilator in the street in New York City, in Manhattan. Maybe you can, I'm not so sure, but it seems doubtful. But I can pretty much tell you where you can buy one in Mexico City if you want to. In La Colonia, Buenos Aires, you can buy absolutely anything you want. You can buy a car, you can buy a ventilator, you can buy anything you want. And this has been going on for 50 years or more. What happens? We don't have the health system. The health system was not prepared for this. So they're bringing in ventilators, as many as they can from China, perhaps some from the United States. They're bringing in gowns, they're bringing in face masks, they're bringing in just about everything they can. But of course, the opportunities for corruption in a country like Mexico, given the scarcity and the rush to get things ready, those opportunities are enormous.
I completely agree. And Felicia, that story that you tell us, that you share with us, is terrific. Because as you said, I mean, the ventilator is the most difficult part in intensive care. I mean, it needs an intensivist, very well trained, in order to give the proper attention for the ventilator. So having those things it's a good picture on how, with scarcity, with a shortage in the supply and the possibilities of supplying services, and with an excess demand that we are going to have, as Jorge was saying, there are always possibilities there. The second aspect on policy that corruption may emerge is that when government do the buying of what it is needed, and when that buying comes in emergency time, regular processes are not observed. You want to buy whatever you can because it's needed, and nobody is going to question how you do that buying. So we have to put also an eye on what is at the end the government buying, and how is the government buying all those stuff.
We have a very interesting question, I think, from Marco Amendaris. And Jorge, I think this is one you're going to find of particular interest. What does this crisis mean to the Mexican ruling party? 18 months after the overwhelming victory, winning the presidential election. Do you consider this could be a trigger for a unified opposition with real chances to redraw the Congress composition in 2021?
Well, I think that is an excellent question, a very interesting one, and Felicia, and it's one that almost everybody asks themselves or ourselves in Mexico every day. We know two or three things. We know that the president's popularity and approval ratings have gone down. They began to go down before the crisis. This began probably in January or February, with the stagnating economy, then with the women's movement around International Women's Day that he ignored and dissed, so to speak, and now has continued because of his erratic or confusing response to the crisis. The polls are there. We have seen his popularity drop. And so there are many people who believe that next year in the legislative elections or midterm elections for the House of Representatives, that his party, Morena, will lose its majority. That's one aspect of this. A second aspect is that he doesn't have any money. He has run out of money. He didn't have money before, and he has even less money now. And so he has less resources to hand out to his groups, or the groups of people whose support he has, and to carry out his pet projects, whether they are infrastructure projects or whether they are social programs for the elderly, for the handicapped, for whoever. He doesn't have any money. And in Mexico, a government with no money becomes an unpopular government. We've all lived through this. We know what it is. And there's no reason for it to be any different this time. And the opposition hopefully can become more united now because it has a greater incentive to do so. And that incentive is to win a majority in 2021. And then in the recall election that is scheduled for 2022, to beat López Obrador. It's a recall that he invented. It's legal, it's his invention, and to try and beat him because he can be defeated in 2022.
Yeah, probably I would just put into place that on the economic part, we're not discussing if we are going to have or not a recession. That is for sure. What we are discussing is if we are going to have a depression, and that is going to happen or not because of what the government does. But there's a rule of thumb that when the economics collapse, governments have problems. So how government reacts and answer to the economic crisis, I believe is going to determine in many ways what happened over the next couple of years with the ruling party.
You mentioned, Jorge, you mentioned the incredible movement that we saw on March 8th, that I think was inédito. We hadn't seen such a movement as that among women and the entire population because of the femicides. A question here that we've got from Tim McDonald is, how does increased unemployment affect women? Are they going to end up becoming overwhelmed in terms of other kinds of work they have to take on? Are they going to be more hard hit by the economic crisis that we're going to see? And of course, what might we do about this?
Well, it seems, Felicia, I don't have any hard data, but it seems that women are being disproportionately affected in Mexico and elsewhere in Latin America for several reasons. The first, of course, is that they have a higher participation in the informal sector of the economy than men do. Perhaps the exception are the maquiladoras in the north of Mexico, but even there that has changed. Women are disproportionately represented in the informal sector, and the informal sector, of course, is going to be the hardest hit, one. Two, since schools have been shut down in Mexico, public schools have now been shut down for over a month and will continue to be shut down at least until the beginning of June, and perhaps through the end of June. Inevitably, it turns out that the burden of dealing with the children at home falls disproportionately on women. Obviously, much more on single mothers than on married couples, but even in married couples, given machismo, given the realities of Mexican life, that burden falls disproportionately on women. And so that's the second factor, which can be very serious. And finally, unfortunately, there are signs of this. I don't know, Salomon, if you have heard more about this. Having people in shelter, locked up in their homes, very small homes, with not much to do, with kids screaming, without anywhere to go or anything to do, and with the availability of drinks and other things, because you don't have to go to work, because you don't have anything to do. So what do? You drink. Domestic violence, intra-family violence has probably grown in Mexico the last 2 or 3 weeks. And obviously it's going to be disproportionately against women.
I completely agree with Jorge. We already know of this growth in domestic violence. Because many of Mexican houses, moreover, are small houses. So if you cannot go out, if you are in a small place, living together on an everyday, day-to-day basis, and with all your economic problems and all what we feel by being isolated, and it is incrementing domestic violence. I have to say also, in terms exactly what Jorge was saying, the proportion of women on the informal sector, the informal market, it's huge. Only to put an example, and because they don't have a formal job, they don't have Social Security. For example, 2.4 million women working cleaning houses do not have Social Security. And that's a huge majority of women that dedicate their lives to clean other houses. In the formal market, we still see very big, huge inequalities on income, on payment. Because on the Mexican system, if you are going to lay off people from your payroll, you have to pay a compensation. It is cheaper for some businesses to lay women than men, because many women are already having a lower income, and it's cheaper to lay them off. And that may have a huge impact on women poverty over the next couple of months.
And I'm also, you're absolutely right. All of the evidence that we have from around the world is of an increase in domestic violence against women, against children. And I'm very proud to say that actually our Institute for Advanced Study of the Americas is leading a new Lancet commission, looking specifically at issues globally. This happened before the crisis, the COVID crisis. And we are dedicating ourselves with several of our professors in the university to try and share these very complex lessons learned about how to manage this. And we'll make sure to our audience that we get together a panel specifically on this issue that I think is so important around gender issues. Let me say we have really very interesting questions pouring in. And Joaquin Roy, one of our own professors here at the University of Miami, had sent in a question, and he asks, is what is the role of different systems of integration that we have in our region? Mercosur, CARICOM, UNASUR, SICA-CELAC, what could they be doing to help have a stronger policy and political response, a coordinated response in our region?
Well, I think the political agencies or instances that have been created over the last 20 years, or going back to the OAS the last 60 years, really are not playing much of a role, and they can't really play much of a role. Mercosur has been very severely weakened for many years now, and is in a particularly delicate situation today because of the very deep confrontation and personal animosity between Presidents Bolsonaro of Brazil and Fernandez of Argentina. And if Brazil and Argentina don't get along, then Mercosur practically doesn't exist. The same is true for most of the agencies. The Pan American Health Organization, Salomon knows more about this than I do, but the Pan American Health Organization can do important things. It's a solid organization. It's an old organization, and it really has a lot of influence in many parts of Latin America. But that influence can be both good and bad. For example, it was announced a few days ago that the Argentine government, President Alberto Fernandez, has invited 500 Cuban doctors to Argentina to aid Argentina, who has one of the highest ratios of doctors per capita in the world, to help the Argentines for some strange reason in dealing with the virus. And the Pan American Health Organization, in the case of Brazil, before this, played a very dubious role in terms of participating in what clearly are very severe human rights violations carried out by the Cuban government when it rents or sells its doctors to other countries. So I think it's important to distinguish between good influence and bad, but so far, most of the political instruments of integration, etc., are not playing much of a role.
And if I can, I mean, Jorge is the expert on it, but most of the international organizations work better when the adult in the room, which used to be the United States, put some order. I mean, it was clear during the Ebola crisis, during the 2008-2009 economic crisis, that President Obama and his administration did play the adult of the room place, and they really make international organizations cooperate and work for better or for worse, but they work. The Ebola case is one of those. Now that the U.S. President Trump has resigned to be that leader, I truly believe that multi-countries organizations are more in another mood. No, so and the Pan American Health Organization and the World Health Organizations are going to be very important on the next steps. For example, when we in a year or a year and a half find a vaccine, who is going to get it? How are we going to get it? How are we going to do a equal job through countries? And how money is not going to be the only variable playing there. I mean, I think the United States plays a very important role on whatever is going to happen.
So we have still a good lot of questions coming in, and if both of you are available, maybe we'll stay on just for another 10 minutes to answer some of these. One, I think very interesting, Nilsa Cayos is asking about the projection of the economic impact on Miami due to the economic crisis in Latin America. Do we have any thoughts, concerns, and worries about that, gentlemen?
I just have to say that Miami has become by far the place in which more corporate offices for Latin America businesses is placed. A lot of Latin America business flies through and from Miami, and what the IMF and other expectations of how the economy is going to look like this year and next year is not very encouraging. So if we see a decrease of 3 or 4 points of the regional GDP, Miami is going to suffer. I don't have any doubt.
Absolutely.
So we may see a rich culture growing and flourishing in Miami. And this is something that I know that our own university is going to be looking into and looking into closely. Now, another question, Abi Martinez. How do you see the US and the influence of China on South American politics? How is that different today than it was 20 years ago? And there's another question in the background that is at least somewhat related, which is, you know, what happened with the WHO and the questions that President Trump put forward regarding WHO because of his comments around China and how we feel about China in this global calamity. Any thoughts on that?
Well, a couple of things quickly, Felicia. First, it's not just President Trump who has been somewhat critical or very critical of the Chinese response to the virus from the very beginning. President Macron of France has also been very forceful in this regard. The British have, to a lesser extent, the Germans have. In other words, there are several leaders in the world today who have criticized the Chinese government for the way it reacted, especially at the very beginning, in terms of secrecy, lack of transparency, lack of sharing information, etc. It's not just Trump. Trump takes it out on the WHO. Basically, he's cutting funding for the WHO because he considers them to be too pro-Chinese. Maybe that's an exaggeration, but what's not an exaggeration is the issue that there are many important criticisms of China in this regard. Secondly, in the case of Latin America, yes, there are some people who believe that China is sort of filling the void that Salómon described in terms of the United States. If the United States doesn't play its role, China will. I have my doubts. I have my doubts, first of all, because I don't see the Chinese having the capacity, the capability of really being present in terms of delivering either ventilators or gowns or face masks or technical assistance or medical assistance, etc. I have my doubts. And secondly, because, you know, a lot of people who have dealt with China, when the Chinese lend you money to build a highway or to build a hospital or to build a bridge or to build a dam or to run a mine, end up not being very happy because the Chinese do not tend to respect labor standards, environmental standards, human rights considerations, etc. And these things have become important in Latin America over the last 30 years. And I think that's a very positive development. So I have my doubts about the Chinese menace against the United States and Latin America.
This is going to be, you know, a very interesting piece of this analysis that comes forward. And I thought, let's take one last question from our own Sally Hughes, who's a member of the University of Miami Institute for Advanced Study of the Americas community. And Sally, who's an expert on issues regarding the press, has mentioned that even in El País, they've been highlighting incidents where cartel members are distributing despensas in different parts of Mexico. What sort of an impact is this going to have? Is it just publicity? Is it really happening? And of course, in the kind of economic crisis that we've been speaking about, how is this going to play out? Any thoughts?
Salomon?
Por favor, Jorge.
Look, I think it's, you know, terribly disgraceful for this to happen in Mexico, that the cartels publicly deliver food supplies, perhaps medicines, other things to the poorest sectors of society. And they do so openly with the picture of Chapo Guzman or others on the boxes that they deliver. That they can do this openly, that nobody stops them from doing it, nobody arrests them, and the poor people who receive them, cannot turn it down. What I think it's showing in Mexico, and this is probably true elsewhere, but we don't know, in Mexico it's had a lot of publicity, is that the government has limited resources available. And so if it's using more and more of its resources, human resources, the army, the police, the navy, the hospitals, the money to attend to the coronavirus crisis, pandemic, it has fewer resources to try and contain the drug cartels. And the cartels see an opportunity, a window of opportunity, and they're taking advantage of it. And they will continue to do so. At the same time, it's not that the cartels are resting, so to speak. Mexico had the highest daily number of willful homicides 2 days ago, the highest ever, 114 willful homicides in a single day. We've never seen anything like this. So you have the cartels on the one hand giving away despensas, and you have the highest levels of violence in modern Mexican history on the other hand.
Yes, and we have to know that in very specific regions of our country, since long time ago, parallel assistance systems by the cartels have been part of the day-to-day life.
So I think we've had a very interesting hour and a little bit together. I wanted to ask each of you if you have any final comments you'd like to make quickly, and then sum it up and invite our audience to our next event. Jorge, do you want to start?
I mean, very quickly, Felicia, because I think we've covered practically everything. This is one of the most serious crises Latin America or the world has faced since World War II, perhaps. In economic terms, certainly the most serious one. The social consequences will be enormous. We've talked about all of that. The question is, one, how quickly do we get out of this? And two, what do we do when we get out of it? How do we build the type of welfare states that we now know are terribly deficient? What can we do in terms of reducing the inequality, which became much more visible now than it was before, even though it was already present? And also, what kind of international cooperation can we have on a greater scale? Because clearly the level of international cooperation that has existed over these last couple of months has been insufficient.
Thank you very much again. It's a fantastic opportunity. Probably a message for the medical personnel, physicians, nurses, a message of solidarity. For us that are staying home, pues let's try to make good use of that time. No, read that book that we left there, see that movie, play with our kids, and try to teach them resilience. For example, myself, I'm third generation born in Mexico, but my great-grandparents had to get out from the First World War and the Russian Revolution, and those were difficult times. Let's teach our children that life sometimes have difficult moments, and that it is going to pass, and we would have to learn a new normality, and it's going to be good.
I want to thank both of you for joining us today. Jorge, particularly as our guest, for all of your support to the University of Miami into our institute. I want to highlight, as we're going to be doing throughout this series, that there are opportunities within this crisis. that we have new forms of communication, we have new ways of thinking about how to enjoy different parts of our lives, and we have new responsibilities to think about the many who, even when we come out of the health crisis, are going to see a whole set of challenges, and we have the responsibility to think about how to help them through that. I want to remind us, we've been together for 1 hour today, 1 hour and a bit. And in that hour, we lost 275 people in our world to this virus. That number will continue to climb for a while, but we are seeing flattening curves in many countries. We are seeing new science. Our own Miller School of Medicine has come up with some very important discoveries. And so we look forward to being able to share with you in about 2 weeks' time another segment. Salómon will be joining me again. And thank you all for spending this hour with us. Thank you for being part of our community of Latin America thinkers at the University of Miami and in the community that is our own city of Miami and Latin America. Have a good afternoon. Keep safe, stay well, and stay home if you can. And thank you to all of you who are at the hospitals, at the clinics, supporting our patients, supporting those families who are in need. We truly appreciate you.
Thank you, Felicia. Un abrazo, Saló.
Abrazos virtuales. Virtual embraces to all. Bye-bye.